I'm proud to be here with Rear Admiral Dr. Nancy Knight, Director of the U.S. Centers for Disease Control and Prevention's Division of Global Health Protection. For nearly 20 years, Dr. Knight has been instrumental in the development, coordination, implementation of public health policies and programs in the U.S., as well as in several countries around the world, including Nigeria, Kenya, and South Africa. She is currently part of CDC's agency-wide COVID-19 response. Without a doubt, COVID-19 is an unprecedented global health challenge. Close to 40 million cases and over 1 million deaths worldwide. A crisis that requires global coordination, collaboration, and commitment across all industries, sectors, and communities. Thank you for this opportunity, Dr. Knight. I look forward to talking to you about the virus and CDC's work to help keep people safe.
Thank you so much as well. It's my pleasure to be here with you and with our audience today.
Why don't I kick it off? As a leading agency for disease and prevention and control, what is CDC's role in global health security?
Thanks for that question. I think as we think about CDC's role in global health security, we need to take a little bit of a step back and actually look at CDC's beginnings. CDC started in 1946 as an agency that was established for malaria control, actually domestically in the United States. In just a couple of years, in 1948, CDC began working on malaria control internationally. It was at that time when the agency partnered with the Imperial Iranian government and worked with them on developing their country's national malaria control program. So since then, since our beginnings in malaria, we have grown to become an agency that focuses on non-infectious diseases as well as infectious diseases. And we've been involved in global programs, particularly around these infectious diseases, such as smallpox eradication, which occurred in 1980, polio eradication initiative, influenza programs, HIV and AIDS. The list really goes on quite extensively. And this is quite important when we think about how we got to where we are today as on global health. The other aspect of global health security that is extremely important are two really critical events. One is the SARS outbreak in 2002 to 2003, which Canada and Toronto were significantly affected by as well, and as 29 countries in total around the world. That SARS outbreak kind of opened the eyes of the world that no one country can really protect itself all by itself because of the way in which diseases can spread faster and further than they ever had been before. This triggered a change to the international health regulations. And in 2005, the World Health Assembly voted to modify the international health regulations to include countries' responsibility for being able to detect, respond, report, and work together on infectious disease outbreaks that could affect one another across borders. That was in 2005. So jump ahead then to 2014. By 2014, the countries across the world that had agreed to the international health regulations had been challenged in really being able to meet them. About 70% of the world was still not prepared, still not meeting the international health regulations. So in 2014, in February, the world launched what is called the Global Health Security Initiative, or GHSA. And GHSA really sets a framework for how all countries should approach achieving those goals of the international health regulations. Within the US government, we are signed on as a member to the Global Health Security Agenda, and CDC is one of the lead agencies for the US government in implementing this with partner countries. So when I then come back to CDC's role in global health security, it really builds upon this historical work that we've done over the decades in identifying diseases and helping to work to eradicate them and to control them all around the world. It really builds upon the international health regulations and the importance of achieving those and doing that through this specific framework of the Global Health Security Agenda. With the Global Health Security Agenda, one final point to note is that there was a specific group of countries that we as the US government partnered with around GHSA, or the Global Health Security Agenda. And with those countries, we've invested about $1 billion across the US government into 17 countries to help build their capacities.
Wow. How does the CDC prepare for disease outbreaks such as COVID-19?
The way in which we prepare through this framework of the Global Health Security Agenda is really focused on building these core public health capacities. These capacities that can help to prevent, detect, and respond no matter where the outbreak might be occurring and no matter what the specific disease might be that's causing it. When I talk about core public health capacities, it really kind of boils down to four main things. We do a lot of activities, but it can be boiled down to four main things that kind of cut across all of those activities. And these four main things we call the core four. And those are work in surveillance systems, work in laboratory systems, work in emergency management systems, and work to build the public health workforce, or the people that are needed on the ground. One example of how these things all come together and work effectively during an outbreak, I can look back to my experience working in Nigeria in 2014 during the Ebola outbreak, when I was deployed back to Nigeria from South Africa to serve as CDC's team lead there within the country's response. And the outbreak itself started when an individual traveled through multiple other countries and landed at the airport in Lagos. That's really when the surveillance system kicked in. So he was ill, he landed in the country, they quickly got him to a hospital, they tested him for malaria, which was more common, and once they knew it wasn't malaria, then their suspicion for Ebola really perked up. That's then when the next part of the system, the laboratory part, kicks in. And because of the capacities that had been built in the laboratory system through partnerships, including CDCs, they were able to test for Ebola in country and get a diagnosis very quickly. And then the third part of the system, the emergency operations, was kicked in once they knew they had that diagnosis. And that really came from the experience in polio. They brought the Emergency Operations Center from northern Nigeria and all of the people who knew how to run an emergency operations center down to Lagos. And they established that. And then lastly, the people. Another core component are the disease detectives that had been trained through a partnership with CDC since 2008. And these are the Field Epidemiology Training Program graduates. So across that whole response, we had these disease detectives that then did all of the daily monitoring of contacts and looking out for any new cases of Ebola that would occur. So all in all, it took about 2.5 months to officially have the outbreak declared over, with only 20 total cases and only 8 deaths. And in a setting of Lagos and Port Harcourt, which are cities that have a combined total population of about 23 million people.
Wow. It does beg the question. So where are CDC's people located?
Yeah, so CDC, as you think about us as the United States National Health Public Health Agency, is located obviously in the United States, and we have people all over the United States. But we also have people in countries all over the world. We have more than 60 CDC country offices all over the world. Those people that are working in those country offices work often not only within the country to which they're assigned, but they will often also work within the region and in collaboration with other countries in the region. So our reach extends broader than just those 60 countries where we have people assigned. Through the Global Health Security Agenda, because that's a multi-country initiative, there are 69 countries around the world that are signed on to that. So also through that network, we're able to have a greater reach as well.
What kind of progress has CDC seen since investing in the GHSA?
The progress that we've seen since investing in the GHSA really is something that we identify through looking at the data. We are a data-driven agency, so it's really important to us to look at discrete, measurable progress. In order to do that, we have established a monitoring and evaluation system, and we work with countries and with our staff in countries to identify specific benchmarks that they can achieve on an annual basis, and then we track the progress towards achieving those specific benchmarks, particularly across these core 4 areas that I've talked about. I think one example, we've seen many improvements over the last several years since GHSA was established in 2014. One example that I'd really like to touch on is from Sierra Leone. In Sierra Leone, in 2014, during that Ebola outbreak, they had a surveillance system, but it really wasn't functioning very well. It was paper-based. There were a lot of errors in data entry. There were a lot of gaps in data entry. And there were a lot of their public health facilities around the country that simply didn't report like they were supposed to. So as we worked with them during Ebola and since then, we have helped them to take that system and transform it into what is now an electronic integrated disease reporting system. Through that integrated disease surveillance and reporting system, they now have all of their public health facilities, which is more than 1,300, reporting on a weekly basis across a number of infectious and non-infectious diseases that are important to them. So including things like malnutrition, for example, as well as Ebola. This has allowed them to increase their reporting from only about 40% with a lot of gaps back in 2015 to now more than 99% of their facilities reporting every single week. And as it relates to COVID specifically, because it's electronic, they're able to adapt it very easily. So they were able to add COVID into this reporting system just earlier this year.
So that's probably a great lead in to a thought process around how has the learning that the CDC's done in working with infectious diseases helped for the global response to COVID-19?
Yes, we've learned a lot of lessons during our global health security work that have been really applicable during COVID-19. One thing that I mentioned when I was talking about Nigeria earlier is this workforce program that we have. It's called the Field Epidemiology Training Program, or FETP. That was established back in around 1980. And was really based on what we do here domestically in the United States through a program that's called the Epidemic Intelligence Service, which trains disease detectives to function here at state and local level within the United States. Since we started the FETP in 1980, we have now trained more than 18,000 disease detectives around the world. With COVID, we specifically reached out to many of these training programs. We reached out to 65 of these FETP training programs, and we asked them, are your trainees and are your graduates being used in the COVID response? And we were really excited to hear the results that came back from them. So we learned from these 65 programs that the trainees, from 85% of them, are actively engaged in the COVID response in their countries. We also learned that graduates, from 100% of them, from all 65 programs, are actively involved in the COVID response in their countries. So when you really think about a return on investment and that investment that we've made in human capacity and in training these individuals, it's huge when we have 85% of the program's trainees and 100% of the programs with graduates that are active. And they're active across all of the different aspects of the COVID response, from the surveillance aspects, to the contact tracing that's involved with that, looking at risk communications, and very importantly, in many countries, actually part of leading the overall response.
As you think about that capability then, and you think about some of the other core capabilities, are there other examples where the GHSA has helped improve our response to COVID-19?
Yes, thanks for that question. I think we have a lot of examples where we have helped to improve the response to COVID-19. Another one that I could mention is Uganda. Uganda is another country where we've had partnerships between CDC and the Ministry of Health since the early 1990s. And this has been across a number of different diseases, hemorrhagic fevers like Ebola and other hemorrhagic fevers, HIV, tuberculosis, and Uganda was also one of those 17 countries that we intensively focused on with the global health security agenda. With this partnership that we've had, Uganda has been able to ramp up their response to COVID even before it hit the country. So I'll tell you what I mean by that. Back in January, on the 26th, they activated their Emergency Operations Center for COVID in order to have this much more intensive focus on the preparedness aspect that would be needed for COVID, recognizing that it was very likely to come into their country. They did this while they were also responding to other outbreaks. They were activated for things like Crimean hemorrhagic fever. They were activated for MDR-TB, and they were activated for Ebola because of the outbreak occurring next door in the Democratic Republic of the Congo. So on top of those other activations, they also then activated and started planning very intensively for all of the mitigation efforts that would be needed to be able to identify and address COVID when it would enter the country later.
But you can definitely see the benefit then of the preparedness and really being on their front foot almost if you can be in disease response. Let's shift the conversation a little bit towards supplemental funding. And how has the supplemental funding that CDC's gotten helped countries prepare?
Yes, thank you. Supplemental funding has been critical for the work that we have been doing as an agency in COVID-19. On March 6th was when CDC received its first congressionally appropriated resources for global COVID. This was through the Coronavirus Preparedness and Response Supplemental Appropriations Act of 2020. So within that larger appropriations, the component for global was $300 million. So that $300 million US dollars we were able to take, and through our own Emergency Operations Center in Atlanta, work to identify within these countries where we were working, what were some of the very critical aspects that they needed resources for immediately to help them to address COVID. So things like training in infection prevention and control was really important. In Vietnam, we've been able to support that, where it includes also making sure they have safe specimen collection as they collect samples and transport of those to laboratories for their testing. We've been able to do that across 30 provinces there. We've also been able to use some of those resources for development of some of the global guidance on water, sanitation, and hygiene that's necessary for helping to mitigate COVID, and for some of the surveillance activities that we've been doing, like I've mentioned earlier. In addition to those acute immediate needs, we also recognize with something new like COVID, we need to learn more about it. So we were able to use some of those resources to invest in what we call operational research, helping us to learn how to better characterize the disease, how to learn more about transmission and about the risk factors to continuously help to improve upon the responses in these countries.
Other than the $300 million in congressional funding, has CDC received any additional funding for global health security in developing countries?
Yes, so the first appropriation that we received from Congress was the $300 million US dollars. On March 27th, we also received from Congress through the Coronavirus Aid, Relief, and Economic Securities Act, or the CARES Act, an additional $500 million US dollars specifically for CDC's global disease detection and emergency response activities with other countries. So these resources, coupled with the first $300 million that we received, will allow us to be able to continue some of these very necessary COVID-related activities past the immediate time period. These resources are available for us to use until 2024. I think as we talk about not only the resources that have become available to CDC to use and resources that others are bringing to the table for the COVID response as well, it's important for us to think about what does an outbreak actually cost us. And when I say that, I don't mean what we are investing. I really mean what does it cost us. We know that it costs us a tremendous amount in terms of the lives lost and the lives affected. We also know that it costs us a tremendous amount when we look at the global economy. When we look at Zika and the outbreak that occurred in 2016, the World Bank estimates that that outbreak cost the Latin America countries and Caribbean region about $3.5 billion. Now, when we look at COVID, the IMF estimates that the costs to the economy are huge from COVID. That with this pandemic, we have a cost of about 375 billion US dollars every month. And they predict that there's going to be a cumulative loss to the global economy over 2 years of more than 12 trillion US dollars. So it's important that we think about what we invest, because that investment, whether it's now during the time of an outbreak or investments during times when we don't have outbreaks, those investments are really critical to help us to mitigate the impact on human lives and the impact on the economies.
Those are huge numbers.
They are.
As we think about COVID-19, COVID-19 is teaching us some lessons. What have we learned from CDC's work with COVID that can use to inform global response to future outbreaks?
Yes, every time we have an outbreak that we respond to, there are lessons that we learn. There's no doubt in my mind that from all of the work that we've been doing over the last number of years and all of the outbreaks that we've helped to respond to during this time period, that we and the countries that we work with are better off around the world. That doesn't mean that everything's perfect. That doesn't mean that the public health systems are still at their top performance. So we need to continue to keep our foot on that gas pedal and to continue to keep working on improving these systems. When we look at outbreaks, every outbreak is different, even though they all need these core capacities for response. And we think then about the lessons that we learn. We learn lessons both before an outbreak occurs, as well as during an outbreak and after an outbreak. Some of the things that we do before an outbreak occurs are exercises. So like what we call simulation exercises. Uganda's a good example of a simulation exercise that was really effective when Ebola entered their country just last year. So in April of last year, in preparation for Ebola, that was already occurring at the time next door in the Democratic Republic of the Congo, they conducted a simulation exercise. Just 2 months later, in June, they actually had a case that got imported from the Democratic Republic of the Congo. And because of that simulation exercise, the hospital that was in the simulation exercise was able to take care of that patient and identify the case of Ebola very rapidly. When we talk about during, we talk about things like what we're learning right now every day about COVID. It's a new disease, and so it really means constant learning and constant application of those lessons and sharing of that information, particularly around things like our control measures, being able to make sure that we understand how it spreads, that we understand to do our social distancing, to wear masks, to do hand washing and cleaning of surfaces, other things that can keep the transmission of the virus at bay. And then lastly, when I talk about things like after, when an outbreak is completed, we do after action reviews. And we really look in detail at what happened and what are some of the lessons learned from what happened so that those can be addressed and corrected for the next outbreak.
I was thinking about your 4 critical capacities. I was wondering if you could comment on what have we learned about building lab capacity?
Yes, we've learned quite a bit about lab capacity. Lab capacity within this outbreak has been extremely important. One of our partners, I'll touch on maybe a couple of examples as it relates to lab capacity. One of our partners that we work with on the continent of Africa is the Africa CDC. This is an organization that pulls together and works with all of the national public health institutes of all of the countries around the continent. And by national public health institutes, I mean CDC type entities, public health entities. So in our partnership with Africa CDC, we're able to work with them on these, on the trainings and the translation of information, looking at how to plan for and implement their laboratory testing in countries, and be able to have a broader reach to all of the countries across the continent through that partnership. Another example of laboratory capacity, maybe at a country level, is Vietnam. In Vietnam, we've had a partnership there for more than 22 years. And this is one where we have a lot of lessons that have been applied in the laboratory setting. Vietnam really scaled up their laboratory testing very rapidly across their population. We worked with the Ministry of Health as well as the National Institute of Hygiene and Epidemiology to establish a national public health reference laboratory for it. And this partnership that we as CDC had with them helped them to be able to scale up the testing. This laboratory strategy has helped them to limit their cases. In Vietnam, they have just over 1,100 right now, and has been extremely important in identifying cases and then being able to apply those mitigation measures as well.
Shifting gears a little bit, what challenges and priorities do you anticipate the world as we transform to long-term response and recovery from COVID-19?
Well, we certainly know that public health emergencies are challenging. They've proven this in the past, and COVID-19 is continuing to prove this right now. They also, though, help to serve as a reminder of how important it is for us to have these strong public health capacities in every country around the world, and to be able to respond very quickly to emergencies when they occur. We experience challenges when there's an outbreak of a disease that we recognize and already are familiar with, like Ebola. The Democratic Republic of the Congo right now is in the middle of its 11th Ebola outbreak. And the lessons that we've learned around challenges and have applied to previous outbreaks are really important in that partnership and controlling that Ebola outbreak right now. Especially as we're learning about something new like COVID-19, it's still really important that even when we have challenges, that we ensure that we are using what we already have and what we already know, like these core public health systems. It's important that we continue to have a cycle of learning, particularly with something that's new like this, so that we can continue to adapt our approaches and apply those learnings so that we can have the best and strongest mitigation and response possible in every country. We know that a vaccine is still in development around the world. We know that we have to remain vigilant until we have that vaccine available. In the short term, we really have to, one of the challenges I think that we all have to face is to learn, how do we coexist in a world that has COVID-19? How do we continue to function well as individuals in society and as organizations and as public health systems to make sure that we're taking all of the precautions that we possibly can and prioritizing ourselves and our communities in its response.
On the global front, what kind of mitigation measures are various sectors taking to stop the spread of COVID-19?
We see that different sectors within society are applying these key mitigation efforts in a variety of different ways. The main mitigation strategies that we really focus on, of course, are the physical distancing, staying further away from people at 6 feet apart, things like wearing masks to cover your nose and your mouth when you're out in public, cleaning surfaces, and practicing really good hand hygiene. We've seen a variety of innovative ways to apply these depending on the different sector. You look at sporting events and athletes and things like the NBA bubble here in the United States that's been applied. Having events without spectators in the seats. Looking at other mass gatherings like concerts or theater performances, limiting those numbers, holding them outdoors and with physical distancing has been really important. Restaurants have made a lot of pivots to have easier way to do curbside pickup and deliveries and making sure that they're not having crowded spaces. Schools and universities are also facing the application of mitigation measures so that they can ensure that the students are able to continue learning during the environment of COVID-19. And within the travel sector, a variety of different ways in which they are applying it, depending on whether it's a hotel or an airline. They are working to protect their patrons as well as their employees by using these very important mitigation measures. We have to remember that every country is different and every community is different. So tailoring these and making sure that they are culturally sensitive is also really, really critical to ensure that they're being utilized to the greatest extent possible.
As we think about global needs, where do we need urgent attention focus these days?
One of the urgent needs that we see globally is still around some of the quantities of some of the commodities that are needed. Things like the personal protective equipment that's needed, as well as the laboratory supplies that are needed. Some of the innovative measures that are being used to address this are looking at ways in which local capacity in countries can be expanded to increase production for both laboratory as well as personal protective equipment. Reusable personal protective equipment is something that has also been utilized. And then also looking at the distribution and the supply system so that they can get out to the communities where they're critically needed. The mitigation strategies that I touched upon a moment ago, the social distancing and the mask use, that's really still the best way that we can reduce the transmission in the communities. So making sure that there's universal use of these mitigation strategies, whether it's at home, in the community, at work, or at school, is really, really critical. While close with the vaccine, we're still not there yet. So that certainly is a critical global need to continue that work on the vaccine, but at the same time, to preparing for when one will be available. So making sure that countries have the appropriate vaccine regulatory approval processes in place, making sure that they have plans for how they're going to deliver the vaccine and move it out to the communities once they get it. Those are also some really critical needs that we have and we're working on right now.
The next global health emergency is probably a matter of when, not if. How are we better prepared globally now for the next one?
When a health threat strikes, all countries need these core public health capacities in order to really be able to effectively detect, prevent, and respond. So it's really through these systems that we are better prepared. The improvements that have been made worldwide in surveillance systems, in emergency operations centers, in laboratories, and in a public health workforce. These are all really critical. During this COVID-19 pandemic, we've been able to see that not just the examples I've talked about, but many more of the partner countries that CDC has around the world have been able to strengthen their outbreak response systems, and they're much better prepared than they were just a few years ago. The other important aspect really are not just the systems, but the partnerships. Being able to exchange ideas, being able to have relationships that have allowed us to continue working with countries all around the world and sharing our success stories, as well as sharing those from one country to another, has been really important for our collective efforts towards keeping the world safer from disease threats.
And how do you think we're positioned now? Are we in good shape? Do we think we need to work on? What can we be doing better to be ready for the next health emergency?
I think compared to several years ago, globally, we are better off today because of the investments that have been made in global health security, as well as in other disease programs than we've ever been before. Many of the examples that I've touched on today really wouldn't have been possible if it weren't for some of these improvements that have been made. COVID-19 is clearly a threat. It is our present threat, and it is envisioned to remain a threat for a while. So there will always be not just COVID now, but as we look to the future, there are always going to be this risk of having an emergent disease that poses risk to our health and to all of us around the world. What's really critical and what we need to make sure that we are all doing is to have all sectors, not just the public health sector, understand these risks, understand the risks of failing to prepare for the full potential of a public health emergency across all sectors, not just across the public health sector, and to have all of them play an active role in preparedness. We've definitely seen this in global health security agenda, where multiple sectors across a country are involved in the planning and the preparedness. And I think the urgency for that is even seen more so now that we've had the COVID-19 pandemic with us.
Are there any specific needs that you're focused on to help us prepare for the next pandemic?
I don't think that we can predict all of the specific needs that we might have with the next pandemic. I think for me, the highest priority would really be to sustain and expand these core public health systems and preparedness activities. As I mentioned earlier, we've come a long way, but we're not there yet. We have to continue working on these core systems. We know that when we have these systems in place, they are critical to being able to detect and identify an infectious disease outbreak and respond to it. We know how to continue to learn what the right interventions are, whether it's improving upon interventions for outbreaks that we've dealt with before, or developing and implementing interventions for new outbreaks like COVID-19. When I look at what we have in front of us, we have a lot of the right tools in our toolbox as public health professionals and as the world. We need to really just work collectively across countries, across all sectors in these countries to apply these tools, not only now, but also think about how we continue to build them so that we can always apply them in the future as our preparedness for the next outbreak.
Well, Dr. Knight, I want to thank you for spending your valuable time with us today. That was truly insightful into how to CDC, what they've been doing, how we're prepared. I myself want to meet a disease inspector as we go forward, but I appreciate your time and your insights, and we're all better off knowing what we learned today. Thank you for your time.
Thank you so much. I've really enjoyed getting the opportunity to talk with you today and with all of our audience members today. I look forward to continuing to interact with you and work together as we work to improve preparedness for response to outbreaks around the world. Thank you.